Well, good evening, friends, and welcome tonight. Reverend Russ Pierce, I serve as Executive Director of Housing for New Hope. I've been here serving for 7 years and was really delighted as I was looking at the registration list for tonight to see so many folks that have been friends and partners in the Pitt Council. Many of you for a number of years, predating Housing for New Hope's leadership of that effort. This is the fourth Wednesday of January. This is a traditional night for Pitt, and so we're gathering much as we have in past years, not to go out and do a count tonight, and we'll talk a little bit about that more as we have our conversation tonight. But we'll be gathering together to learn a little bit we're going as a community in terms of supporting our most vulnerable neighbors here in Durham. We are going to jump in. I will say we're having a few technical challenges with how the webinar is presenting. So I think that you can see a screen that says tonight's conversation. What I'm hoping you can do is on your settings, if you will go to your view and mark that if you'll go to view and mark, let me see here, speaker view, that would be terrific. That will increase the chance that you're seeing who's speaking, just because some of the challenges that we're experiencing. I think you should also see a presentation in the background with the roadmap for tonight and our conversation. We're going to be talking about our community strategic framework to prevent and end homelessness, learn a little bit about how we learned from Pit Count in the past and will in the future, and other data and how that's going to inform our work, the city and the county's roles. We'll have some time for Q&A for your questions. That's already open. So if you are having challenges seeing things, let me know there and I will keep an eye out for that. Again, thanks for your patience. And we are going to shift. Let's see here. To kick us off tonight, we're delighted to have Mayor Williams with us. We also have Dr. Mike Lee, chair of our Durham County Board of Commissioners. They will be in dialogue a little bit later in the conversation, but delighted that Mayor Williams is going to kick us off from, I'm going to say, an undisclosed location somewhere in Washington, D.C. He's making a big effort to be with us tonight. Mayor Williams, if you'll go ahead and unmute yourself, and if we've done everything right, we should be able to hear and see you.
Hey there. Hey there, Russ. Can you hear me okay? Thumbs up,
Yes.
thumbs out. Oh, you
Yep.
can. Okay.
Yep.
Well, first of all, it's good to see everyone here that I can see, and it's good to see the numbers of the turnout tonight. And while I wish we were doing it the traditional way, which, out and about, we are still keeping this work going. And I want to start, first of all, by thanking you, Russ, and your team for leading just doing an incredible job at our pay count in recent years. Um, some people may not know what it is, but it's what I got from it, and what I get from this work is it's a time for the community to really come together and truly show in tangible ways how we care for one another, even those that have less fortunate situations. And it's an effort where the community comes together with pride to try and like just build one more resource to support, the municipality, the government, the county, the city in a way that could generate resources and generate data for us to be able to solve this issue that we call homelessness. Now tonight we're going to have a bit of a conversation. I'll be back in this secretive looking location in the stairwell, and sharing the screen with my friend Chair Lee. But we'll get a bit more in detail because I'm really excited to talk about the work that we've done, since we've last been together. But I just wanted to open it up and say thank you for you and your team for the work that you all are doing and all partners involved. And I look forward to coming back on screen and hanging out.
Thank you, Mayor, and thank you for joining us. And we have over 200 people with us tonight, so very excited. Even on our best pit count night, we were maybe at about 150. So this is really incredible time for the community to be able to come together. So we are going to first tonight focus on a little bit about the work that's been done over the last 6, 7 months creating a new strategic framework to prevent and end homelessness. So I'm going to invite Ryan Smith, director of the Durham Community Safety Department, and Anise Vance, who's assistant director of stabilization, to come on screen. And again, if we're doing it right, as they're sharing, they will pop up. And guys, I will be your kind of Vanna White with the presentation as you go through. You just need to tell me when um, to advance it. But maybe just start in a simple way. Um, why are we working on a strategic framework at this time? Why is this important for Durham and our most vulnerable neighbors?
Thanks, Russ. I mean, I think we're working on a strategic framework, one, because we have many partners that we need to do this work. This is bigger than what any one government agency or any one nonprofit. And when you talk about big, challenging work that involves many different people needing to move in the same direction, having a strategy, having a common goal, understanding the direction that we're moving in, how quickly we want to get there is really critical if we're going to be successful in this work. So, to me, having a strategy is an indicator that this is complicated work that is going to require a high level of collaboration and that we're all going to have the same North Star. And that's one of the things that we've been working together on with you and many other partners across the continuum of care to make sure we know where we want to be in 5 years and how we're going to get there together. And I think it's overdue and something that is going to hopefully serve us really well and moving to make significant reductions in the number of people who are experiencing unsheltered homelessness in Durham. So if you want to go to the next slide whenever,
Absolutely.
I want to say one quick thing. I want to build off one point the mayor made. The mayor talked about pit count as a time when we come together this time of year and you know that the pride that we take, the things that we learn, the way that we it builds momentum for the work ahead. And even though this was a week where we did not come together in the pit count, I do want those in attendance to know this has been a really remarkable week where folks all across our continuum of care and community have come together and rallied in very meaningful ways to significantly increase the number of safe, warm beds that we have for people in Durham who are unsheltered. And we have together, through all of our partners, through Open Table and Families Moving Forward and Urban Ministries and many other like volunteer organizations and Entry Point and others, added over 180, I think over 200 beds now that we don't normally have on cold nights. And I think
Mm.
that's a great thing about the spirit of what the pit count has been of coming together. I think we can tap into that. And I think it also highlights the kind of work that we're going to have to keep doing and what this strategic framework is really about. It's that it recognizes it's going to take robust collaboration. We're going to have to find a way to sustain that over the long term. And it's also belief that when we come together, we can do big things. And so for the last, community safety became the lead agency in support of our continuum of care this summer. And when we kicked that off in partnership with our many partners to develop the strategic framework tonight. So just a real quick preview. We're going to be talking about this in full next month. And so go ahead to the next slide. Thank you. I want to talk a little bit about just the process. This has been a process that hasn't been, just like folks in government. This has really been a community, a collaborative project that has involved a leadership team that represents many leaders across our system, an advisory group that has dozens of other leaders representing health sector, business, philanthropy. We have also partnered through multiple listening sessions with frontline workers. And then importantly, we have done work out in the community directly listening to people who are actively experiencing unsheltered homelessness. All of that has been going on over the last 6 months to help inform the strategy that we'll be talking about in more detail. And also, one other thing I'll note is that we've been doing all that work internally. We've also been taking time to learn through our partnership with a technical assistance provider that has worked with over 100 communities across our country with cities that have been able to show measurable reductions. And so all that is coming together. Next slide, please. Because this is Pit Night, I think when I think about what Pit Night is, it's a chance to see firsthand and to observe what this is like for our neighbors who are regularly experiencing unsheltered homelessness. It's a great time for me to talk about one aspect of this, which is the listening that we did throughout this project. And so, in addition to these different leadership tables and advisory groups, we spent time listening directly to folks who were actively experiencing homelessness in Durham and asked them what are the things that they wanted and needed through a variety of different interactive exercises out in the community. Next slide. One of the things we did is we asked folks if this thing were available, would you use it? And people got to vote. And I think one of the big takeaways from that was the single thing that people wanted the most was housing. Housing in different varieties, whether it be independent housing or tiny homes. Those were the two biggest things, followed by a place to be during the day. But if we have housing, that's less important. And then critically, case management. It came up time and again about how this was a critical resource that can really help people on their journey and something that we know we don't have enough of. Next slide. I highlight this when we talk about pit count because sometimes there's a misconception that I have heard, maybe you have heard, maybe you've thought that people choose to be homeless. And the reason that someone is living in an encampment is because they don't want to be anywhere else. And I think that what we heard through this listening and what we've experienced is uh, while that may be true, it is true for a very, very small percentage of people. And the vast majority of people who are living unsheltered in Durham want housing and want to get off the street. And I think that's an important message when we think about this plan of making resources available, meeting people in their needs, and not accepting that or believing that this is a choice. And we saw this was a great quote from one of the exercises of someone who said that they would choose none of these, but also said that they wanted housing, named that they were okay living on the street, but if they could get their own place, they would take it. I think that there's an overwhelming number of people who are experiencing unsheltered homelessness who would really like and move into something if we could make it available. And you'll see some of that reflected in the things we prioritize in the plan. I'm now going to turn it over to Anise, who's the assistant director in our department to finish this up.
Hey everybody, good to be online with y'all, and thank you all so much for coming out to this event. And Russ, thank you for putting this event together. This is just such a wonderful opportunity to talk about the work that we are all collectively involved in on homelessness. So just very much appreciate being here. Russ, would you mind flipping over to the next slide there? So, we wanted to talk a little bit about what the fundamental goal of the strategic framework is and wanted to name that very clearly. It is a numeric and a measurable goal. And by June 2031, we want to achieve something that people term functional zero for all populations. In some ways, you can think about that as ending homelessness, but in a little bit more detail, what that means is that, we know that there will always be some inflow of people into homelessness. What we want is a system that has the capacity to make sure that anybody coming into homelessness can be housed within 30 days, right? And that is a lofty, ambitious goal, not only for Durham, but nationwide. Trying to do that by June 2031 is about as ambitious as it gets. And we know that we're going to need all of our partners as part of that. We're going to need every individual who is willing to assist in Durham as part of that. We're going to need a lot of cross-sector support. And so we're so happy to be here with you all to sort of share part of this vision. Part of functional zero, I talked about, that 30-day window of people experiencing homelessness. That would be in other words, we describe that as rare and brief, right? You'd experience homelessness and it would be rare and brief. A big part of achieving functional zero is having real-time data, having data that can tell us if we're actually achieving that goal month to month to month. And so that's, a part of the vision in terms of what we're trying to build. We obviously want a system that is equitable, where no groups are left behind and where we're serving everybody in the system. And we want a system that's sustainable. Once you achieve functional zero, that doesn't mean that, you get to sort of say, hey, we've done this for all time. No, you have to sustain it once you get there. And so we're really on a long journey here, and we're on an exciting journey, and a journey that's going to require everybody. Russ, would you mind flipping over to the next slide? So, to get there, the strategic framework outlines a 5-pillar strategy to reach our goal, right? We're really spending a lot of time in this first section or in this first pillar of the strategy right now, and you'll see why. It's the foundations for an effective system. So those foundations include building the right kind of data, having the right kind of governance, having the right kind of resources, having the right kind of communications around this, such that as we move forward down these next 5 years, we're not always looking at the floor of the house thinking, oh, there's cracks in this. We need to get, somebody in to fix the real foundation of the house. No, we're thinking about putting in windows, and we're thinking about putting in the roof, et cetera, et cetera. The second pillar that's part of this are effective ways of working. Like I said, this is a framework that will require everybody: homelessness providers, healthcare providers, the philanthropic community, the business community. Everybody in Durham will have to be engaged in some form or fashion, all of these sectors, in order for us to achieve this goal. because we know the population experiencing homelessness is affected by each of those sectors. So one thing that we're really thinking about as well are what are the right ways to collaborate? What are the right ways to work together such that as we move forward, we can have pathways cleared? A third thing we're thinking about is the enabling, what is often referred to as enabling conditions. Really, what that means is, well, can we align our narrative, our policy, and our resources all together, right? Can we be speaking the same language? And is everybody aware of the language and the importance of speaking that same language? We introduced a key part of that language today, functional zero, right? And so that's a part of that. Can we kind of influence these conditions? A fourth element here is our homelessness reduction strategies. At the end of the day, you have to have a way to say, hey, look, we have a person who's experiencing homelessness. How are we going to get them from A to B to C to D, and then finally into a housing placement? And so we have to think long and hard about our strategies and then continue to refine them over the next 5 years. And then the fifth thing is our backbone operations. Do we have the right kind of staffing and capacity to make sure that we can sustain this kind of ambitious framework over the next 5 years? Russ, do you want to switch over to the next slide there? We want to very much invite you. This is just a little preview, and I'm sorry I'm going so fast. I want to make sure I'm not taking other people's time here, but this is just a little bit of a preview of a longer presentation that will be delivered to the Joint City Council and County Commissioners session on Tuesday, February 10th at 9:30 a.m. at City Hall. If you're interested, we would love to have you there. We'd love to have you, to make sure that you're kind of, hearing all of this information. And you'll get to see us in person a little bit as well, which would be lovely. We love meeting everybody in person. And then the final slide here is
the one you're most excited about.
This is the one I'm most excited about. So, in conjunction with this framework, and because the framework is so invested in data, right? If we don't know the number of people who are experiencing homelessness in Durham on a month-to-month basis, then we can't really say if we're making progress towards functional zero or if we meet functional zero. We are so fortunate in Durham that we've had folks like Housing from New Hope who have been really thinking about data, who have been leading the PIT count, who have been laying a foundation for us to be a data literate homelessness system. And now we can kind of, take that foundation, maintain it, and also add on this additional layer of pulling data and information from our homelessness management information system. That's the system that all of our homelessness providers use every day. And so it has up-to-date data as we have on our homelessness population. Take that data in aggregate, and make sure that we are reporting that data out to our providers and then also out to the public. And so we have a new dashboard that gives very high-level data on the homelessness population. There's some screenshots of it in there. I was going to plan a little bit of time to actually go through parts of it, but now that I'm looking at our timestamp here, I don't think I'll have time for that. But we will make sure to send out this link. It is live on the city's website. If you Google Durham Community Safety Department and go to the city's website, there's a tab that says Strategic Plan on Homelessness. If you click open that tab, there is a link that says Homelessness Data Snapshot, and there you will see a dashboard up top, and then those three other links below it, three other pop-out kind of links below it that show different portions or different views of the data and more information. So I strongly encourage you all to go there. We're committed to updating this dashboard once a month to make sure that folks have accurate data on homelessness in Durham.
Yeah. Thank you both. And I'll say, really do take time to go and visit the website. And depending on when we wrap up toward the end, maybe we can get in and show it. But it has as you can see on the screen, it's very good at breaking out the different populations that we serve within this broader sector. And that's really important because people have very different needs. And so depending on their circumstances. So for us to be able to have a better sense of the needs that a family might need that has children versus a couple that's a family that are both adults, those are very different things. And so how do we make sure that we're serving them well? And there's also, it's terrific on the website, there is a section of definitions, which is always really helpful. And I'm going to jump in and say I used PIT and didn't define what the heck PIT is. So PIT is the point in time count, which is a HUD mandated once a year, generally speaking. But when we shift in a minute to Samantha and Anthony, they can explain a little bit more what the pit count is and that it's kind of every year, but maybe not every year. So we'll make that shift. Now I'm going to ask them to go ahead and start coming on screen and say a word of thanks again to Ryan and Anise for what they've shared with us. I also just want to give a shout out, and hopefully this is okay, that when we needed to come together very quickly last spring to have the resources that were going to be needed for bringing a partner on to lead us through the strategic framework planning process. The city and the county stepped in, of course, but Duke University and the A.J. Fletcher Foundation also stepped in equal parts with the city and county, which was a great sign of this collaborative work, bringing together foundations, government, and one of our anchor institutions here in Durham. So just wanted to quick make sure that we shared that that had been a really important part of us being able to move on this in an extraordinarily quick sort of way. So Samantha, Anthony, welcome. And I am again going to be your live human clicker over here. So I'm going to ask you all first if you would just tell us a little bit more about what pit count is for folks that may actually not be familiar with that. And again, that's on me, but build that out a little bit better if you would than I managed to. And then maybe talk about why we aren't doing the pit count this year.
Yeah, thanks, Russ. I'm Samantha Smith. I work on homelessness strategy and response in the office of the county manager at Durham County. And I'm going to talk and then hand it over to my colleague at the Hope team, Anthony. So the point in time count is a semi-annually, I'll talk about that in a second, count of unsheltered folks in Durham. Typically, it involves an excellent event that Housing for New Hope has put on for the past few years. We usually get to gather at the ballpark and go out into the community, and we visually count the folks who we see experiencing homelessness. And that is an incredibly important activity within our continuum of care because it helps us get data to make decisions on, and it also helps us maintain HUD compliance, which is really important to maintaining some funding and helping our services continue. And as you just heard from Ryan and Anise, we have been doing a lot of learning this year. We've been learning from our community. We have been learning from people with lived experience, from our stakeholders, from our homeless services providers, and from technical assistance experts. And so one bit of learning that was brought to the Policy and Planning Committee of our governing board, which is called the Homeless Services Advisory Committee, is that HUD actually only requires us to do that unsheltered pit count every other year. And so we're in a time where we're really focusing on learning, taking stock of our activities, and trying something new if that feels appropriate. So we were charged on that Policy and Planning Committee with gathering a group to advise and make a recommendation on what we should do this year in 2026, given that learning that this only has to occur every other year. This group met from about twice a month from October to December of 2025, and this included previous pit count administrators. I would be remiss if I did not shout out pit count extraordinaire from Housing for New Hope, Shantae Addison. She was an excellent contributor to this group. We also had homeless services providers and homeless services executive directors, homelessness data experts, city and county staff, as well as some stakeholders from Duke. They are a constant partner for us. And this group talked about some of the underlying goals of the pit count apart from HUD compliance, because we'd certainly want to maintain compliance with HUD's directives and their requirements. And some of these goals were having high quality data on which we can base our decisions and engaging with our community. So this group ultimately decided to recommend to not hold the traditional unsheltered pit count this year and to hold a community event instead. I just want to note, this doesn't mean there's never going to be a pit count again. This was a decision just for January of 2026. And in fact, I'm hoping all of you will join us in January 2027 when we are required to hold a traditional unsheltered pit count again. So There's my volunteer.
We've got all of your emails now, so just saying.
And so to refer back to this framework, this framework acknowledges that the framework, excuse me, that Anise and Ryan were just speaking of with our ambitious goals of getting homelessness to functional zero. This acknowledges that pit count data is really valuable and is a key part of maintaining HUD compliance, but it also emphasizes using other forms of data that are collected more frequently than PIT to help us reflect on our progress throughout the year. Some of HUD's requirements for the traditional unsheltered pit count are that it occur in this very cold month in North Carolina, January. And it's, a one night count. It's not a longer term count than that. And so we are planning to in the future couple this data, the PIT data when we are required to do so, with additional data that is just collected more frequently. So the work of the previous pit counts are still incredibly important and they will resume in the future. And with that, I am just going to go ahead and hand it over to Anthony to talk about some of these new approaches.
Thank you, Sam, and thank you everyone for having us. And a special thank you to you, Russ, and your team for helping us to put this together and to keep us connected with all of these beautiful folks that have been involved with this count over the past few years. I too am fairly new to Durham. I've been here. This is my third year, and I've been involved in both prior pit counts with you, alongside you going out into the community, trying to meet our unsheltered neighbors and get them connected to services. Sam really did a great job of explaining what the pit is and the process by which the committee decided not to engage this year. I wanted to talk about that from a little bit of a different perspective. And so you'll notice that the slide that Russ has on the screen kind of shares a little bit of some of those differences. Particularly, we're looking at those top numbers where the moon is. So if you will notice at the 2025 pit count, we counted 196 people. And that is a pretty good and accurate average number of folks that are typically counted as unsheltered. It was a little bit higher this year than it was, for example, in a prior year. But when we look at HMIS, we can see that over a longer period of time, over the course of a year, we are thinking that there are somehow over 1,000 people that are unsheltered in Durham. And so we wanted to take this opportunity to, as we are involved in the strategic framework discussion, as we are involved in a lot of learning around best practices, we wanted to take this time to do a little bit of a reset. As you might be familiar, our street outreach team transitioned from Housing for New Hope over to the Durham Community Safety Department. And so that team is staffed up and has for the past 6 months been out in the community meeting our unsheltered neighbors. There also are a number of street outreach programs in the area that are out and getting involved, and those groups are working complementary together to make sure that services are available for our unsheltered folks. And so I wanted to make sure that, in the decision not to do it this year, there are a few things that we're going to be doing to prepare for 2027. So in 2026, we will be having quarterly counts that will be mostly staff driven. Those quarterly counts, and by the way, I want to take a step back and say that there are separate counts. There's an unsheltered count, which is what the community typically volunteers and goes out to do. And there's also the sheltered count. The sheltered count is required annually, and we will still be reporting that accurate number to HUD. It's the unsheltered count that's required every other year. And so it's an odd number of years. So we wanted to make sure that this year we take the opportunity that HUD has given us by not requiring this count to have our street outreach team go out, meet the neighbors, collaborate with other street outreach groups, and to make sure that we are doing our very best to know where people are, to have good rapport with them when we are encountering them. And we want to make sure that we are using our PIT data as a complement with HMIS. We're pairing those two things to try to get a better picture of what's happening. So these quarterly counts that we'll be doing, we'll be comparing that side by side with the HMIS data. HMIS data is our homeless management information system. It's the system that all of the folks who are homeless seeking services from us is how we track what happens to them in our system. All of this is to support our households more effectively. We have been taking a number of steps internally within this community safety department and the lead agency for the continuum of care to better understand the unique needs of every household we've served. We have improved what's known as case conferencing. It is how we track people that are seeking services from us and connect them to housing and other supports. And so all of this is really connected. The PIT count, unsheltered, sheltered, data, how we are serving our folks. And we're taking really this year to take a deeper dive into this data. It's one of the reasons why Anise and Ryan have made this dashboard available for the community tonight. And we hope you will take a look at it and stay tuned as we work through bringing you back in January 2027 with a rebooted PIT experience. So thank you, Russ, and thank you all for being here.
Yeah. Well, and thank you, Samantha and Anthony, for how you walked through it. I mean, I think one of the realities, even for those of us that are in the work day in and day out, I know that the Homeless Service Advisory Committee, you've heard us reference that a couple of times. It is a joint, it's constituted by the city and the county. It has partners from across across our service area. And honestly, we have over the years had so many different sets of data come forward. And there have been times where I was like, okay, so which data are we really pinging off of? Like we knew that PIT was a good way to get trends, but it wasn't giving us an exact number. Sometimes we talk about McKinney-Vento, which is the numbers that the school system uses, and they are dramatically higher than the PIT numbers. And so I think one of the real gifts of the work that community safety has brought, and Anthony and his leadership with the HOPE team, and Samantha's work with the planning and policy group, is for us to really, again, start working from one set of numbers, because there are all these different numbers. I feel like piles of numbers is not a good technical word, but piles of numbers out there. And now we're going to be able to work from one system and then use things like PIT to undergird what that one set of numbers is going to be. So really appreciate all that work that everybody's done. Thanks so much, Anthony. And I'm going to invite, I'm going to actually turn off the screen here. I'm going to stop share, hopefully successfully. Invite Mayor Williams and Dr. Lee to join us.
Hello, good evening.
Good evening. Good to see you, sir. Good evening, Mayor, again. Well, you've heard some updates, and I know you're getting an even fuller update in a couple of weeks, in addition to some of the briefings you've had on where we're heading with the strategic framework. So, Mayor Williams, if I could start with you, I'm just curious to hear your sense of how will this new strategic framework help the public better understand the scale and causes of homelessness in Durham and the roles that residents can play in supporting this work across the community.
Yeah, so and I hope you can hear me. If it gets spicy or dicey, let me know and I'll adjust. But recently we launched the largest collaboration effort that we've had amongst the city and the county. Am I frozen, Russ? Oh no.
You're good so far.
Amongst the city and the county to reduce crime, right? And it was one silver bullet effort. It was organizations, residents, nonprofits, the city, the county, the schools, every entity around public safety. Well, we're doing the same thing when it comes to homelessness. We're doing the same thing for our unhoused community. And I believe that, what I can say is, this winter, with the cold weather, we are seeing Durham at its best. We're seeing people who we don't even know step up and serve and say, hey, we're open our church, we're open our shelter. And just the framework really is about collecting data, being able to aggregate that data and help inform our community as best as possible. so that we can know where we can not only have a shared understanding of what homelessness actually is, but also what causes it, what gets us to that, gets an individual to that point, and try and prevent it as much as possible. At it through the same lens of, it's a triage. We want to attack it head on. From triage, we want to be able to, just stop the bleeding, right? And then you want to, you want to treat it. It's a diagnosis, and then you treat it. And after treating it, is what's the prognosis? And that's the same approach we're going to take with homelessness, and it requires everybody and every resource that we have access to, those who we know and those who we do. So this framework really is about data collection and information sharing, so that we can have a much more targeted way to move forward.
That's really helpful. And let me ask, one of I've joked with you, Mayor, that I still have one of your campaign flyers. It's in my other workspace. Otherwise, I'd be flashing it right now. That said, we're going to start reducing homelessness by, I think, 10%. And that's an incredible goal. And I think in the end is going to line up with the strategic framework very well. But that's a big commitment. How do you see the city increasing its investments, and is it going to take something beyond just the city and the county investing to make this possible?
Oftentimes when someone thinks is how are we going to pay for it? This is going to cost a lot of money. And I just don't believe in that question being a destabilizing question. I believe that it's a part of the process to getting to the point of achieving whatever goal it is. I know that reducing homelessness by 10% annually is an ambitious goal. But, some time ago, people were talking about, metal birds flying in the sky. It was unrealistic. There was no way you could pick this big machine up and make it fly. Somebody didn't even think twice about it. My point is, we can't be afraid to be ambitious. And I don't think that, I don't think that it's not something, I don't think it's too big. I don't think it's too ambitious. I think it's realistic. And what inspired me to use those words and state that public goal was I'm seeing the veracity of how deeply this city can.
I think we may have just lost you there. Give it a second. Oh, I think we lost the mayor.
Yeah.
But I'll step in here because did he come back? There you are.
Yeah, I've seen how hard this city loves and cares for one another. So
Yeah. Well, and I apologize. It is breaking up a little bit.
When I see that, I'm so sorry about that.
You're fine. You're good.
Yeah. When you see how hard the city cares for one another, you there's no way you can be afraid to be ambitious. I know we can achieve it.
Yeah. Well, and I think one of the things we've seen here, even in this last week, the Homeless Service Advisory Committee met earlier today, and I think one of the things that really struck us is you, for the most part, have a lot of the same providers in the conversation. More people are definitely coming into the conversation, into the work, which is amazing, and volunteers from the community. But the biggest change has been the city taking a different approach to its leadership, being the hub in a sense that brings us all together. And I think we have seen an extraordinary, as you're saying, outpouring in this last week of a very coordinated, sophisticated, really effort during a really dramatic drop in temperatures and the ice and different things. And I think for a lot of us, it's been enormous encouragement that, with the right kind of hub leadership, the backbone, as Anise talked about earlier, that we are going to be able to really conquer something pretty amazing.
Russ, just real quick, another ambitious goal was Activate Durham, where there are 130 churches that have committed to opening their doors in the case of an emergency. But just think about what just happened. Just without considering the county's shelter or the shelters that we already have, we were able to add an additional 180 safe, warm beds for our neighbors. We did that because we are now we're looking at our resources and the use of them differently. Schools are meant for kids to go and learn, right? But they can also be a warming center.
Mhm.
So we're just looking at being more innovative with what we have before us. I keep saying Durham is resource rich, but in the past we've been collaboration poor. We're changing that. We're making the right investments in our time, energy, our efforts to work together, and I'm looking for us to be collaboration wealthy now.
Yeah. Absolutely. And Dr. Lee, I think one of the pieces the mayor just referenced was one of the schools, and that's kind of falls on the county side. I don't think we often all realize, how many supports the county is investing in for those that are housing insecure. So I'm curious, as you've been learning more, Dr. Lee, about the strategic framework, how do you see the county continuing to partner strategically and invest in these efforts across the community?
Well, I think what we have to understand is the county can, I think we can continue to build that partnership,
Hmm.
with the city while we're working on the city and the county strategic framework. And then we have to break down these silos that we continue to have, aligning homelessness incentives with the continuum of care goals. Now, the goals here are really important. Those of you who have seen me on county commissioner meetings and so forth, I always talk about goals and I talk about measurement as well. And so to see the presentation, to see the goals, to see the metrics that we're trying to collect here and that we are collecting is really important to me because um, as an IT executive, we work to fail fast. We want to be able to measure and make pivots and corrections as we go. So as we measure these things, as we look at goals and we continue forward, you know, is this actually accomplishing what we wanted to accomplish? And if not, how do we support it to accomplish it? And if it doesn't, let's try a different direction. Let's try a different pivot. So that I think the county can continue to work with the city and continue to work with our partners, continue to work with you all to make sure that we're actually achieving the goals that we're setting out to.
Mhm. That's terrific. And do you sorry, I lost my train of thought here. Um could you just for 1 second, because we've had a couple questions coming in from this side,
Mhm.
could you just highlight a couple of the ways the counties invest like in some of the housing and security challenges that people have?
Oh, absolutely.
I'm not trying to play stump the chair, I promise. So,
No, that's fine. It's completely fine. So the county invests in a lot of different ways to address a lot of the issues we're talking about today, homelessness, food insecurity, and so forth. For example, the county, we administer the SNAP program to cover the defray of food cost, through the Department of Social Services. We also do the energy assistance program for that's from the state. I think that's funny from the state. We administer that as well. We provide low income homeowner tax relief to try to keep people in their houses. That is one of the best ways to help prevent early onset reason for homelessness
mhm.
itself. We administer state child care subsidies. We provide, you know, other like very early life necessities through our Welcome Baby program. But we also administer, funding for the mental health and pharmacy services for those who are unhoused as well. We invest in rental assistance, and also this fiscal year that ends in June, at the end of June, we will have invested $180,000 in the eviction diversion program this year. So we have a lot of things going on, but in addition to those, the county invests $2 million of ARPA funding into the Unite the Street Medicine program. It provides health services, a connection to folks who are experiencing homelessness here in Durham. We provide medical respite care with Project Access, transitional housing for folks with justice involvement, who've been justice involved through the Justice Services Department, as well as a location and annual funding and building maintenance for urban ministries. That is an everyday program for everyday housing or homelessness that we may need. But we're also providing funding for a forthcoming day shelter and service center pilot program with the University of Maryland to operate the University of Maryland and UMD. No, it's not University of Maryland. It's
It's
UMD,
Urban Ministries here.
Urban Ministry. I'm sorry, I'm thinking
It's
about
okay.
violence
My brain made the
reduction,
translation.
the violence reduction
Yeah.
program. I got that
Yep.
mixed up there. With Urban Ministry to operate from the Community Resource Center there. So that's a day shelter as well. So we are investing these different programs in a great way, but that's what fiscal responsibility is. That's what, us being pragmatic leaders and making sure that we're actually doing things and measuring them as we invest in them to be good stewards of our money.
And I appreciate that because that aligns so much. I mean, I think the idea of failing fast is so vital, and I think that's an um, underlying piece to some of the strategic framework of what can we try, what can we learn, and how can we pivot very quickly if we learn something that's not working. So, I mean, even this year, a lot of work has gone into bringing a family extra family emergency shelter
Hmm.
online. It was not being utilized as much as we needed to. Storms coming, we're able to shift the singles to that site, shift the families to a hotel,
Hmm.
add in additional services there. The Unite program that you mentioned, they were sharing with us earlier today, which is also a pilot and something we're learning from. They have a medical lab that is out and broadly in the community at certain times. And this Friday, it is going to the hotel where folks are staying,
Right.
both the families and some folks that were very medically vulnerable. So I think we're learning to move a lot faster
That's right.
and
And I
trying things
would
out.
I do want to point out what Mayor Williams pointed out is Northern High School, us using Northern High School
Hmm.
for this winter storm. We had transportation to Northern High School. We had families there. Northern High School, for those who don't know, is we have our culinary department there. That is the state, it's a nationally known culinary group, and they were able to use their kitchen there if needed for food and so forth. So it was just a warming center. It was actually a shelter that we could open up. And that actually worked out really well. We got great reviews, we got great services, great people that was volunteering and working there. So it was a great program to do. It was great to see it happen so very quickly. So those are the kind of things that we have here in Durham.
Absolutely. Well, thank you, Dr. Lee and Mayor Williams. I'm going to ask the others to come on screen. I'm doing my best to see some of the questions and answers that are questions, excuse me, that are popping up. So I'm going to try and just highlight a few of them for folks to just jump in and help answer. One of the questions was around kind of going back to my comment about McKinney-Vento is one data point, pit count is one data point. It'd be helpful to remind us, folks, how that are dealing with the data more, how will this new one number relate to that McKinney-Vento number? And why is maybe the McKinney-Vento number a little bit different?
Well, I think I'll start and anybody can jump in. I think that HUD has four categories of homelessness, and McKinney-Vento and homelessness that deals with the school system is a specific category that is not always considered as unsheltered, largely due to folks that are able to double up or live with family or have some other conditions. And so when McKinney-Vento um, or families with school age children become homeless and are able to qualify in category one, then we're also able to help them through our system in the way that it is functioning now. So McKinney-Vento is a number that we watch, but Anise, can you jump in and help me on that one?
Sure, yeah. So
Thank you.
fundamentally, the McKinney-Vento definition is broader than what is traditionally used by HUD in HUD's definition of homelessness. Now, what that means is that the McKinney-Vento population is larger than the population that often HUD would count. What I do want to say to that is, I think we all want to live in a world where if somebody is counted in a McKinney-Vento definition, i.e., maybe they're not literally out on the street right now, but they are at real imminent risk of homelessness, that would be a population we could support in the same manner that we support everybody who we currently support and is experiencing homelessness. And so, our ambition in this system is to reach functional zero for the folks who are currently in the homelessness system. And the ambition here is to reach across partnerships, reach across sectors, think more broadly, do work on what folks, in the homelessness system sometimes call diversion efforts. So that's, somebody is facing an eviction and perhaps there can be, or somebody has is for whatever reason about to enter into literal homelessness, is about to be on the street, that there's some effort to make sure that that person can stay in housing. So that which people often refer to as diversion is a part of our strategic framework, right? And our strategic framework does include, significant efforts in terms of thinking about diversion. What funding can we bring to bear? What kinds of support do people need when they have that moment of crisis? And how can we make sure then, critically, right? If we're having a robust diversion effort, that means that there are less people who are inflowing into our system itself. So it is a really virtuous kind of cycle if you are able to work upstream on those diversion efforts, on those inflow reduction efforts. And so getting into work that attends to folks who are under that McKinney-Vento definition is really a place that we want to go.
Mm-hmm. And I will add, I mean, often when we're trying to help people understand just some of the quirks, like when I will say back when there was an announcement there was going to be a government efficiency effort, I started making a list with colleagues of like when they were going to open the suggestion box, we had things we were going to send, starting with it would be great if HUD had one definition of homelessness. Because I know early on when I came to Housing for New Hope, this was before we had coordinated entry. Nowadays, if somebody needs resources, help, they've got one number they can call to be connected to a whole variety of resources and shelter and everything. But that wasn't the case 6 or 7 years ago. It was you had to call around a lot of places. So we get direct calls and we'd have to ask questions to know how to route folks and connect folks. And literally one of the question was, if you're staying in a hotel, are you paying for yourself? And this sounds crazy, but the HUD definition is, well, if you're able to pay for yourself, then you have solved your situation. Most of us would not think that if we were paying for ourselves to be in a hotel, that we had solved our homelessness. McKinney-Vento would agree with you. That is not solving it. That would count as experiencing homelessness. And so I think one of the real challenges we're taking on in a great way as a community is we're going to have this broader definition in many ways. So we have a much realer, is that a word? A much more robust definition going forward. Be really good. Let me see here. A quick question. This is going to be an Anthony question. I'm going to make Anthony smile. Somebody is asking if they can join the homeless service advisory group of which we speak. Look at that smile.
Yes, they're actually the seats on HSAC are determined by the interlocal agreement, and those seats are considered and some are appointed by the city and county. The easier way to get involved right away is to join the COC as a member organization or an individual who is concerned and wants to end homelessness and who may have lived experience of homelessness. So I would recommend getting in touch with us at hope@durhamnc.gov. That's hope@durhamnc.gov to learn more. And we will be watching out for your messages and look forward to having ways for you to get involved.
Yeah. And then another question about the heart-based street outreach team. I know H&H did that work for about 20 years and stepped away late June. I'm not sure if this is a Ryan or Anise question, but would you just share a little bit of an update on the work that the street outreach team that is part of community safety is doing now?
Yeah, absolutely. So the street outreach team has been operational now since July 1, which was the first day that we could have possibly been operational given fiscal year cycles. And so we were really proud to be able to kind of do some innovative things in hiring and staffing and training folks so that on July 1 we could have boots on the ground and serving our neighbors. The street outreach team is now 7 people, and we serve well over 100 people who are experiencing homelessness. Over the course of a full year, we imagine that we would serve over 200 people. And our fundamental goal in doing that is to try to place people in stable housing. We've been successful right now with about 15 folks and are actively working to tweak our processes and refine our processes to make sure that we can place more and more people into stable housing. It is a difficult task. It is difficult work. I'm sure anybody who has,
Where did he go?
I'm sure he would say something like, I'm sure anyone who has been doing this work, because there are many partners out there who do this every day, understand the challenges. I do think part of the strategic framework that we are laying out around creating more local flexible dollars to support removing barriers, pathway clearing, to get people into housing, to paying arrears, those kind of things would make the work of street outreach so much easier, investing more in landlord engagement. So I do think it is hard to do that work. And our strategy that we're laying out is really trying to
Mhm.
clear pathways and make it easier.
Yep. It's really helpful. And I know one of the things that was looked at maybe 6 or 7 years ago was um, the the long-term impact for folks that are unsheltered going straight to housing versus maybe having to have a shelter stay. This was research the city did, and it was very interesting because what we found then was that if somebody was connected to street outreach and then went into housing, the percentage chance that they would connect to, a primary care physician, substance use supports, mental health supports was in the 60 to 70% range. Um, and if they had a shelter stay, and then went to housing, it was like maybe a third of that. There's a lot of contributing factors to that, but it's just interesting to think about that if we can streamline, as you're saying, streamline that step straight to housing and make sure the supports are there once folks are there, it can really have an incredible impact. And interestingly, as a factoid, it also tends to save money, which is an important piece. Because if more we can save, the more we can invest in other places. So we do have a number. So let me raise just one more quick question, and then I want to turn to Tasha and Drew. Somebody asked a question I think's on our minds a lot because one of the things that we talk about with the pit count often every year is the number of folks that are unsheltered has been increasing for a number of years here. It was about 50 people in 2018. Last year we were, Anthony, remind me, closer to 200 if I'm remembering correctly, um, in terms of
180,
overall numbers.
184, I think, or something like that.
So we've been seeing like visually we've seen it. You're not imagining that, but it's also an impact on places like parks. And Ryan, how are we approaching, the challenges when folks do make use of parks, um, in terms of that outreach and that connection, knowing that the parks aren't really necessarily designed to have the supports that folks would need to be there for the long haul.
Sure. I mean, I'll talk briefly about how we do it today and then, the longer term goal. So one, we employ street outreach. So we're proactively out. If we come across folks who are encamped, if we receive calls through Durham One Call, which is a common source, or others where someone might share that a neighbor is sleeping someplace or encamped in a public park or even on private property, we will send out a street outreach team to proactively meet with them to understand what their needs are, to make every effort to connect them to existing resources possible, whether that be a shelter if there are beds, and often there's a wait list, to do the work that Anise was saying, which is long, hard work of working if there are no shelter beds, to work on direct placements into housing. So that work is happening. I do think, the longer term vision of the strategic framework that we're going to lay out is to put ourselves in a position as a community that if we encounter folks who are sleeping in our parks, that we can put them into housing in 30 days. And that's, a big ambitious goal. In listening to our neighbors who are living outdoors, housing is the top thing, and top thing that they would like. And we know that their shelter is really critical. There are also a lot of barriers to shelters. Non-congregate places where you're surrounded by a bunch of, other folks, where you may feel that your possessions are not as safe. You may not feel as safe for a variety of reasons. To be able to offer someone their own place, the dignity of their own door that they can shut, a window, those kind of things can make a real difference. And I think that those things are things that you will see as we talk more about the framework. One piece of that is also investing in things that are called like interim housing. So it may be, other communities might purchase a hotel. That's a non-congregate space, is interim housing that can get someone out of, less safe, uh, living on the street where they're exposed to the elements and other things, into a place that is not meant to be long term, that provides dignity and safety while we do the work for housing placements. Or there are micro communities that might be versions of tiny homes, or these pallet homes that provide someone their own space, their own heating and air, a door, their own bed, that are ways that again aren't meant to be the place that we want someone to be long term, but they are providing greater dignity and safety, and autonomy, to have space like that. So these are some of the strategies that we'll be working on, as we work toward that vision over the next 5 years. Anise, is there anything you'd add?
No, that was great. And I'm sorry my computer died right in the middle of a sentence there.
It's okay. Ryan picked right up and kept us moving. So, speaking of keeping us moving, I know there's other questions that have been asked, and I feel like as we have more presentations on the strategic plan and things, there'll be opportunity to ask more of those. But I want to really try and honor our time because we're right up against the schedule. So I'm going to go back to being that weird little talking head in the corner, not loving people sending me little memes of this, but okay, it's the price some of us pay. But delighted to have Drew Woten, Executive Director of Open Table Ministries, and Tasha Melvin, Executive Director of Families Moving Forward. Great colleagues here in Durham. And just was hoping you'd share a little bit about the 100 Days of Warmth and what's been going on with our expansion of emergency shelter spaces and opportunities this winter.
Yeah, absolutely. Thank you, Russ. And it's good to see everyone this evening. My name is Drew Woten. I serve as the Director of Open Table Ministry. We've provided overflow and expanded white flag shelter here in our community. This is our sixth winter, and really want to just share about ways that you can get involved. If you're like me, kind of first thing in the morning, you step outside to let the dog out and you are just blown away by the weather. And it is imperative and essential that there are so many community partners that are stepping up to get folks out of those elements. And so we've come to the table this winter through the 100 Days of Warmth campaign to ensure that no one is forced to sleep outside. And it has been a huge community effort with a lot of partners. Open Table Ministry has been running every single night, regardless of the forecasted temperature, since mid-November. We've done that at Asbury United Methodist Churches at church. And like others have said, there's so many folks who have stepped up. Urban Ministries of Durham, Families Moving Forward, Union Baptist Church, Durham Crisis Response Center, so many things that go into to manage the logistics of getting folks inside, whether that's taking care of the laundry, the cleaning, the meals, so many pieces. And so from this current winter that we're in, I know that goes between 25 and 26 compared to the previous winter. We've more than tripled the number of indoor sleeping capacities for our neighbor this current winter. And that's just a testament to this community-wide effort that takes nonprofit, local government, so many communities of faith, and just partners to come around that. So like it's been said, this last week has really just been an example of the power of community that folks have come together. We quickly pivoted from Asbury over to Union Baptist Church. And so just the importance of being flexible and nimble in that work. And there's just so many things to be grateful for. So I'm going to hand it over to Tasha to share a little bit about that work as well and ways that folks can get involved.
Thank you, Drew and Russ. We started supporting white flag efforts 3-4 years ago, supporting families to get them off of the street the coldest nights of the year. Until this year, we have provided for rooms for families with children ranging in size from 2 members in a household up to 8 members. So when the city approached us to see if we could expand our efforts, we were apprehensive at first, but we knew that we needed to do it. And we've been fortunate to work with so many wonderful partners to make sure that families with dependent children could get off of the street the coldest nights of the year. Union Baptist, the 311 Dowd location, was a phenomenal location for us to move our efforts. To date, we have been able to support more families, but we have not filled that space. So this week alone, we were fortunate that the need for families was so pressing that we needed an extra space in 2026 because it has allowed us to quickly pivot with this extreme weather event that we are experiencing and we will experience through Monday to be able to move families back to 300 North Queen Street, our shelter site, and allow that space to be used for Open Table Ministries expanded shelter. So 24/7, they have been operating since last Friday and will continue to operate in that space until Monday. We will close operations on Monday and move families back to that site. We have been able to partner with the phenomenal team at Union Baptist, the phenomenal team with the City of Durham, the Community Safety Department, and the Hope team. They have been wonderful bringing us all together. We meet once a week to make sure families, children, singles, our neighbors in this community are well cared for and have the support they need so they're not sleeping in their cars or outside or wondering where to go when it's really cold outside.
Absolutely.
Russ,
Eh,
go
Go
ahead.
ahead.
I was provided a list of items that we currently need, if it's okay to share those items,
Perfect.
and then you can pivot to the QR code. We have been fortunate to have the Hope team leading the effort the last week with the extreme temperatures that we're experiencing. Right now, we are in dire need of volunteers to help with the 311 Dowd location, our singles. Through Monday, we really need some volunteers to help us out at that location. We also, specific resources, items that we need sweatpants of all sizes. We need adult diapers of all sizes and that was a very specific number I was given, 4 air mattresses with electric pumps included. We need those items. We are okay with food. We're grateful to be partnered with Salvation Army at this time and Urban Ministries. They are also helping to meet all of our food needs at this time. But the other items are items that we are currently collecting and volunteers. We could really use more volunteers to help with this effort through Monday.
Yes, I mean I think we're all like, oh my goodness, we're going back into snow and things. At least this time it looks like it's snow, not ice or freezing rain. But you'll see on your screen there is a QR code. You can connect to that. That will help connect you to volunteering opportunities, if I'm understanding correctly. We can also, Tasha, if you'll shoot me by email that list that you just shared, we will be getting out an email to everybody with some follow-up info. We have had several requests for the PowerPoint list, the PowerPoint slide deck. We can get that out. We can share this list out pretty quickly so that you have that, so you can find ways to be responding and engaged. We'd really love for that to happen. So thanks, Drew and Tasha. And finally, I want to say a word of thanks to you all for taking time tonight to be with us. Housing for New Hope, about once a quarter, offers a webinar. Okay, I'm going to turn my little screen piece off here. About once a quarter, Housing for New Hope offers a webinar. In the past, we've covered things like what's going on with HUD funding and some of those changes. We've had some of our housing stability coordinators, who in other cases are called case managers, to sort of talk through the work that they do. So really try and provide learning opportunities on a regular basis. So we're using that same platform tonight. And so we will continue to do those and make sure that you all have that information. Also, when we wrap up just a minute, I'll make sure our contact info is there, and also contact info for the city is there, for the Community Safety Department if you have further questions that you want to make sure to get answered. So we are, again, just delighted that you've taken time to be with us tonight. Thank you for your patience with some of our more technical challenges. And just thank you for your willingness to come and learn and be part of the community that is supporting our vulnerable neighbors right here in Durham. I've shared before, and I will say again, one of the great things about doing this work is doing it in Durham, where we have this kind of sense of community, that we have investment already from our city and county governments. That is not the case everywhere by any stretch of the imagination. But it's also such an encouragement. I know a number of staff from the agencies are here, and it is always such an encouragement to our staffs to be our frontline folks to be able to see the broad community of support there is here, supporting the work with our most vulnerable neighbors. Thank you again for being here, and we will follow up as I've shared. Have a wonderful evening.
Thank you, Russ.